Today's talk is about rethinking global health as a field, the call for collective action. So from a very early age, my love for learning, my want to help others and just connect with people drew my career as an aspiring physician to be a very natural decision. But as I went throughout high school, I started volunteering with different community organizations. I started developing a program that basically provided capital and mentorship to new social enterprises in my parents' home state of Orissa, India. That started to shift a little bit. I no longer wanted to just treat patients in a clinical setting, but rather develop health and social infrastructure that went beyond just a biomedical treatment and went towards developing a holistic approach to treating people. So it was at this point when I first came into college and I started talking to some of the people that were around and doing work in that space that I came upon the field of global health. Global health is a field that explicitly demonstrates the need for us to think interdisciplinarily and think about how different social, economic factors, things like food access, clean water access, sanitation, housing, all these different factors play a role in our healthcare. And for me, it was a place where I can combine all of my multidisciplinary interests, right? Everything from anthropology to biology to economics. So let me start off with a number to introduce you to the field of global health. 3.8 billion. 3.8 billion people across the globe lack access to basic healthcare. So clearly the need for us to invest in healthcare infrastructure is very timely and it's very important. But when I mention the field of global health, what images sort of pop into your mind? Most of the time when I talk about my interest in global health, the images that are immediately sparked into people's brains are those of medical professionals from the global north, so say Western Europe, America, very affluent areas, going down into the global south to do volunteer work, build medical hospitals and things like that. Now, don't get me wrong, it is very important that we are able to treat people all across the globe. We have mitigated many diseases, stopped many pandemics because of that work. But in reality, this is a very small part of the field of global health itself. And if it's done incorrectly, it can actually cause a lot of harm to the communities that we aren't really a part of, nor do we fully understand. So let me define the actual field of global health, right? Global health is defined as an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So in essence, it is the health of us all, not just the health of others in other parts of the globe, but also right in our own local community. But that's a pretty broad definition, right? What does this mean? I think it's pretty intimidating as well. How do we ensure that all people across the globe have access to healthcare? 3.8 billion people don't have it. What do we do? So I don't have an answer to this. Obviously, we're still in college, so I don't think I'll ever have an answer to this. If I did, I think I would be somewhere else. But I'm kidding, obviously. But I think the main root of this is actually addressing two main misconceptions, which I'll kind of walk us all through. The first misconception, global health is the health of the other. And this is something that I touched upon a little bit earlier, right? This idea that global health means you have to travel to a different country. You have to go from here to somewhere, a country in Africa, a country in South Asia, somewhere else, somewhere that's not here. But in reality, do we really understand these other communities? A key example of this is actually the voluntourism industry. A lot of well-meaning high school students, undergraduate students will go on these mission trips to other parts of the globe. I'm guilty of it before I did all of this analysis of going to Peru and providing medical care. But the issue with this is that what happens is we end up making the communities dependent on these trips, and also because of language barriers, because of cultural barriers, because of a variety of things, we're not actually able to provide the correct amount of care that's culturally competent. As a result, we may end up actually harming the community more so than helping. So how do we address this misconception? Actually, the best work that we can do in our study of global health is in our own local communities. Because we are at a UConn event, I chose to choose Connecticut statistics. On the left is a picture of the life expectancy in West Hartford Center, which is a relatively affluent, majority white area in, obviously, Hartford County. And the life expectancy there is 84.6 years. Just a 15 to 20 minute drive away in Northeast Hartford, the life expectancy is 68.9 years. So let that sink in for a second. A 16-year life expectancy drop in just the span of a 15 to 20-minute drive, right? This isn't something that's happening somewhere else. This is something that's happening right in our own backyards. So how do we address this? I think the best work that we can do, again, is in our own backyards. And it doesn't necessarily have to be building a brand new hospital. It can be increasing access to fresh food. It can be increasing access to clean water, ensuring kids are able to go to school and they have clean clothes to wear. Simple things like this, improving housing access, addressing climate change and even heat islands. Everything really will address this life expectancy gap. So the second misconception is a little bit of a simpler one. The idea that global health is a field that only has room for people in health professions. Like I mentioned earlier, often what we think of when we think global health is doctors, nurses, PAs. They're going to these other sites and doing global health work. But in reality, this is the global health community. We need engineers that are making the innovations that enable global healthcare delivery. We need healthcare professionals, which is obviously a group that I want to join as a physician, that are actually delivering the medical care to individuals. We need public policy creators who are developing the political and legal framework that we are able to implement these programs in. And lastly, a group that's often forgotten, but artists. They play such a critical role in connecting these campaigns and public health issues in general with the general public and making sure that we aren't rejected out of a community when we go and try to do work. So a little bit back about my journey throughout the field of global health. I got to UConn and I was like, how do I address these two misconceptions as I started to recognize them? And I started I took on the role as executive director of UConn Global Health Spaces on Campus, which was initially UConn Global Health Symposium Organizing Committee. So initially what it was we would hold an annual global health symposium, and that's really grown to engage hundreds of students, both at UConn across the globe. We've gained national and international recognition for the organization, and we've really pulled in a lot of different change makers across the globe into that global health conversation and exposed them to our UConn students. But I also, again, going off of that idea that how do we get more people involved, I founded our UConn Global Health Hackathon, which just completed its third iteration this past fall. And what that does is basically bring together innovators and people from all different backgrounds at UConn to solve global health issues. So both of these both of these events together have really formed the bulk of my initial experience with global health, and I learned a lot of the basic framework about what global health really is. But then going forward, I realized there's another barrier. I realized that there was a lack of one collective space for global health information. A lot of the information that was presented was for academics. It was for university students. It was for professionals. It wasn't really for the community members that actually needed them, the ones that are actually developing organizations in their own local communities. So about a year and a half ago, a friend of mine, Mansi Thond, and I created GlowHub, which is a web platform that gives aspiring global health innovators the resources and the community that they need to affect change worldwide and better lives. So what is GlowHub? GlowHub has three main goals. First, to democratize access to global health resources and research. Two, to enable advocacy, sustainable local and global solutions. And the third, to foster collaboration between all individuals interested in global health. So what does that mean? I'll go through each of these. We wanted to democratize access to global health resources and research by basically expanding who is able to access the current literature that is available. We were frustrated by the fact that you cannot go onto Google and just type in global health resources and get one repository of everything, because it is such an interdisciplinary field. You'll find something in an engineering journal, you'll find something in Nature magazine, you'll find something in something else. So you won't be able to find one specific location. So we addressed this by creating a website that's a screenshot is kind of shown here, but you'll be able to go onto this and indicate if you're a high school student, an undergraduate student, a professional, a community member, and what you're looking for, right? Relevant global health research, advocacy work, whatever. And you will, as a result, be directed to the portion of the website that will be most relevant to your needs. And then we have created this database. Obviously, this is just kind of a mock-up. The actual website is under development. But what we have done is created a database that takes the current existing global health literature, and we've written significant statements for them. So basically a condensed version of the abstract, only a sentence or two long, that is comprehensible to the layperson. You don't require to know all of the technical jargon that you would need to enter the global health space. Rather, it's more just so if you're interested, you can read about this and then click on the article and read more. That really eliminates that barrier for a lot of people to get involved in that actual literature and learning more about it. The second part of this is enabling advocacy, right? How do we develop these sustainable local and global solutions and make sure that community members are all engaged? For this, we have kind of developed a similar tool to what the Global Health Database was, of resources with advocacy toolkits. So we've been able to share with feature different nonprofits that are working in our state across the nation for people to go in and see, okay, this organization deals with food insecurity. I can go and volunteer with them or get an internship with them, whatnot. But we've also started developing some of our own materials because we saw that there was a lack of toolkits and resources for a younger audience, so high school students, middle school students, and just community members that weren't necessarily involved in the global health space. So here are some images from our toolkit themselves. Some of these are also designed to be used as posters, and they're free and available on our website itself. So it's a very basic primer into what is global health, what are social determinants of health, obviously health equity versus quality versus justice, basic ways to get involved. And we've also started developing lesson plans for educators to implement into the high school level and different classes. So you can do it in civics, you can do it in science, you can do it in even math class, because they're pretty straightforward. But it really gets the ball rolling on getting individuals interested in the field of global health. And so lastly, I think this is the most important part, actually, fostering collaboration between all individuals interested in global health. Really, the global health community is huge, but there's no one single stop shop for all these resources, for all these communities. You have academics that have worked for years and decades in the field, but for someone who is just trying to get into the space, how do you reach out to someone who you've kind of idolized for years, right? There's no way that you're able to just reach out to them. Obviously, cold calling and cold emailing are key, but how do you tell that to a 10th grader with social anxiety? That's going to be a very hard conversation. What GlowHub will eventually do is host events and just form a social platform for people who have been engaged in the field for a long time, for a short amount of time, to all talk to one another. It will allow nonprofits from across the globe that are doing similar work to talk to one another and problem solve together. That way, no one's really alone in this whole field of global health. And lastly, I'm super grateful to be able to share my experiences kind of learning about the field of global health and innovating within it. Obviously, there's a lot of questions that are unanswered still because this is such a big field and the need is so great for us to be able to provide healthcare to everybody. But I encourage everybody to start conversations in your own circles, start innovating in your own circles, start working with your own community members and with community organizations, because everyone is needed in the fight for health justice. And now is not the time that we start. Now is not the time that we stop. Now is the time that we start. And we really work together to ensure that the next generation of people has access to health equity and health justice. Thank you.